Hello. So today I'm going to talk to you about recommendations for ages to spay and neuter animals. So previously, I'd say 10 or 15 years ago, the general consensus was to spay and neuter animals around 6 months, unless they were in a shelter rescue situation, in which they were sometimes spayed and neutered way before that. A lot of the rescue organizations and high volume places or whatnot have a rule that says 2 months, 2 pounds, essentially saying any animal that's older than 2 months and bigger than 2 pounds is available to be spayed or neutered. But in the past couple of years, we've really tried to extend that for some breeds. There's kind of a discussion with some large breed or giant breed animals waiting until they're 18 months or 2 years to get full growth out of their joints and their long bones before spaying and neutering them. There was recently a study that was published by UC Davis that kind of gives a chart with recommendations of when to spay and neuter for males and females of different breeds. I've heard a lot of people very strictly quote this study of, hey, this study says this is what I'm doing. I'm a little bit interested in people's kind of thought process on that study, because I'm a little bit hesitant to 100% say, yes, this is exactly what we should be doing, and this is why. So that particular study has a couple of flaws that I don't love, but I will say I think the study 100% shows us that we need to investigate the ages of spaying and neutering a little bit more in the coming years. So the reason I don't love the study is, one, it's a retrospective study on the kind of options for different types of scientific studies. Retrospective studies are one of the ones that has a bigger chance of selection bias, or the people that are running the study being a little bit biased on what animals they pick to kind of sway the results in the way that they want. I'm not saying that happened, I'm just saying that it is a possibility. Two, it was looking at medical records of animals that went to the teaching hospital at UC Davis, and I don't feel that is an accurate representation of the general population of animals. So your teaching hospitals of vet schools, and I actually don't know about UC Davis in particular, but usually you're going to be seeing more complicated cases there, and you're going to be seeing it from patients that are owned by clients that have money, because teaching hospitals do tend to be more expensive than your regular hospitals. So I don't think that's a good representation of your general population of animals. And the last thing I didn't love about the study is it didn't look at any medical issues after the animal was 12 years old. And I'm not really sure why we had that distinctive cutoff of age. I still want to know if it increases chances of certain types of cancer in certain breeds, orthopedic issues, and whatnot. Another couple of things that I would love to have seen with this particular study is, did they think about weight when they were looking at things? Because unfortunately, spayed and neutered animals do have a different caloric demand than intact animals, so they do tend to be overweight if they're overfed. So did that kind of play any part in any orthopedic issues with animals? They didn't really look at specific genetic families to see if there was a real genetic predisposition. I appreciate them looking at breed, but a little bit more in depth with genetics. It just left a lot of open opportunity for future studies. So do I suggest with owners spaying and neutering later with large and giant breed dogs? Yes, but it comes with the understanding that when you do decide to do the spay or the neuter, the procedure is going to be more expensive, and it is going to be more dangerous because you have bigger vasculature that is involved with this. So next, I'm going to be talking about some alternatives to spaying and neutering, and then we'll kind of go with the pros and cons of what we're looking for these surgeries.